Hello everyone, I'm Perla and I'm part of Group B. And now we are going to be presenting pharmaconutrition. The information that I'm going to present was published in a review article called Pharmaconutrition. This article was posted in the Journal of Parental and Internal Nutrition. When we are talking about patients who are feeding with extra nutrients and they are severe ill, then we are talking about pharmaconutrition. 45 years ago, pharmaconutrition was introduced with the name of immunonutrition or immunoenhancing diets. This is because the name is very explicit what pharmaconutrition is. Pharmaconutrition works like increasing the outcome of the patient with ill. That means like it's gonna improve their immune system. In 2008, they come with this idea that they shouldn't be referring immunonutrition as just immunonutrition. They should change for pharmaconutrition because it should be treated like a therapeutic agent. For the nutrition support, we know like ill patients are gonna need like parental or internal nutrition. This is a pretty good way to provide extra nutrients for recovering. We have to be aware like this patient and higher risk of infection, organ failure, and also they increase the mortality rates. Some of the challenge that we have is with patients who actually are positive with systematic inflammation, potential infection organism altered the immunity, and the metabolic changes resulting in hyperthyroidism. Another conflict that we have when we are applying pharmaconutrition is the doses that is going to be applied for each patient, as well the nutrient interaction in their bodies, or the hypermetabolic states, or the genome. We have to be considered as well the routes that we're going to be providing these nutrients and the duration in distinct patient subpopulations. Well, what can we provide in pharmaconutrition? Pharmaconutrition can provide prebiotics, probiotics, and symbiotics, as well magnesium, zinc, selenium, vitamin C, omega-3 fatty acids, leucine, arginine, and glutamine. What we can do is like pick the ones which are more needed for these patients, and we are gonna make a cocktail of these nutrients to improve the immune system. Next, Eugene is gonna talk about a case study, and is gonna talk more deeply how pharmaconutrition works. Thank you.
My name is Eugene, and I will not be focusing on pharmaconutrition, but what's inside that matters. As Perla had mentioned, pharmaconutrition is based on immune therapy by enhancing the immune response. One of the main supplements is beta-1316-D-glucane, which is extracted from the Saccharomyces cerevisiae, which is effective in cold and flu symptoms. Beta-glucanes are polysaccharides composed solely of glucose. Beta-glucane is chained together in the 1316 position and is a potent activator of macrophage immune cells and NK cells. They are found in fungi, cereal grains, cell walls of bacteria, and plants. In the case study, Baker's yeast beta-glucane supplement reduces upper respiratory symptoms and improves mood state in stressed women. The study performed with healthy women that were pre-screened for moderate levels of psychological stress, self-administered a placebo, or 250 milligrams of Wellmune daily for 12 weeks. They used the Profile of Mood State Psychological Survey to assess changes in mental, physical energy levels, and overall well-being. Everything was logged with a quantitative health perception and tracked the upper respiratory symptoms. The end results reported fewer respiratory symptoms compared to the placebo. Global mood state was better, and superior mental and physical energy levels. The outcome provides evidence that a daily supplementation of Wellmune will reduce upper respiratory symptoms and improves mood, state, and stress subjects. The effects of beta-glucans does not stop with improving stress factors. In the study, East beta-glucans modulates inflammation and waist circumference in overweight and obese subjects. A randomized, double-blind, placebo-controlled clinical trial design study with overweight and obese subjects, the effects to modulate inflammation and waist circumference, the results were recorded. The patients were given a placebo and beta-glucan 477 milligram capsules orally for 6 weeks. Anthropometric changes, lipid profiles, liver and renal functions, and inflammatory cytokines were measured. The waist circumference and blood pressure was reduced in the patients that took the beta-glucans after 6 weeks. There was no significant difference between the placebo group and patients who administered beta-glucans. The beta-glucan did, however, increase interleukin-10, which is an inflammatory cytokine, by 23.97% from the baseline at week 2. It also reduced pro-inflammatory cytokines interleukin-6 at week 6 and tumor necrosis factor A at week 2 compared with the controls. The supplementation did modulate pro-cytokines that accelerate overweight, obese comorbidities and reduce blood pressure as well as waist circumference. Cardiovascular disease is one of the big 3 for the risk factors. Big 3 for obese people, and in lowering risk factor ultimately benefits the patient. So up next is Rachel, and she will be talking about some more case studies and some other supplementations.
Hi, I'm Rachel, and I'm going to today talk to you about pharmaconutrition and why this pathway and this formula is so important in treating patients who have severe inflammation. And then I'm going to talk to you about a case study and the benefits of using this formula. So to begin, all of the research that we have done has shown that this formula is not popular in the United States yet. All of the studies that we have found showed that the case designs and the studies were performed in foreign countries. In my study, they talked a little bit about why, and that's because of the efficacy and the safety of this integrative treatment, and it's because in this treatment you use medications, vitamins, minerals in addition to the formula, and so the exact nutrient interaction is still unknown. Now in my case study, the patients all had severe and advanced cancer in the GI tract and just throughout the body. It had progressed to other parts of their body. As a result of this, they had severe oxidative stress. Now what that means is that in the body there is increased amounts of cytokines, which as we know causes an inflammatory response due to increased levels of interleukin-6, INF and interleukin-6. And so this formula has increased levels of EPA and DHA, which are omega-3 fatty acids. And so when these levels are increased in the body, since they're pro-inflammatory, they decrease the amount of inflammation in the body, and the amount of leptin increases, which helps to also combat the inflammation. And again, as we know, inflammation is bad because it attacks the tissue inside the body and causes a multitude of issues. So next I'm going to talk to you about my study, and there were 39 patients, and they were fed 2 cans of ProSure, as you see right here, every day. I know that that's not a lot of formula, but because they were so sick, they weren't able to eat much formula to begin with. They were fed through an NG tube or a PEG, so they were using enteral nutrition, and the patients were assessed once every 4 months to record their progress. And again, they had their advanced cancer patients with severe GI inflammation, in addition to a multitude of other problems. They were basically about to die before this. And they had been eating less than 50%, or for some patients even less than 80% of their daily recommended calories, and so they had significant weight loss and lean body mass before starting this study. So in order to show how they improved, they were looking at grip strength, weight gain, the inflammatory responses in the blood, so they were taking blood samples. And once again, this was monitored once every 4 months. So, all in all, they found that there were significant improvements in each of these categories. The patients gained weight, they decreased the amount of inflammatory response, increased lean muscle mass, increased appetite. So as you can tell, that these are significant increases in overall health, and so thus we recommend that this formula, as a result of this study, we recommend that this study is used. Up next, we have Roberto, who's going to be talking about the challenges of advancing pharmaconutrition, and then we'll give a summary.
My name is Roberto. I'm going to be wrapping up the pharmaconutrition presentation here. We just learned that there are 2 case studies that prove that pharmaconutrition is very beneficial to benefits with different type of syndromes or diseases or illnesses or even obesity. But what's the challenges that are keeping pharmaconutrition from advancing? Well, there's a lot of information, but I'm only going to give you three major key points. One of them is the inconclusive and contradictory information from recent studies. There's also incomplete understanding of the nutrient interactions given to the patients in a cocktail rather than the individual supplementation. And lastly, the half-life of the nutrients when they're administered are also inhibiting the ability to make this type of therapy very beneficial. So, starting with the inconclusive and contradictory information from recent studies, there's just not a lot of evidence to really back up a lot of the information that's been given in the studies. One of them is the type of patients that are used. Some of them are pre-op. Some of the studies are pre-op patients. Some of them are post-op patients. They've also used ICU patients versus medical floor patients. And then lastly, the sample sizes are too small. And one particular study that was very beneficial to the positive outcomes of pharmaconutrition was the Ziegler GLND. That had a lot of very positive results for the pharmaconutrition, but again, the sample size was only 150 patients. Not very beneficial for gaining widespread support about this. And then that leads us to understanding the interactions between the nutrients when given to the patients as a cocktail rather than the individual supplementations. When given as a cocktail, the net effects of the nutrients become so much more complex and unpredictable. From one of my resources that I've read, that I found in Pharmaceutical Nutrition, or in the Journal of Perennial and Enteral Nutrition, it gives 2 examples, one of glutamine and arginine, and another with glutamine and nucleotides. When given glutamine by itself, it does promote a lot of ATP production, but when given glutamine and arginine together, the body cannot figure out exactly which process to use, and it just brings a lot of uncertainty of what the excess nutrients are going to be doing in the body, and without more study and more knowledge about this, it's going to be a problem to advance this kind of therapy. Lastly, the half-life of the nutrient during administration. Again, going back to glutamine, there's also nucleotides that are added to pharmaconutrition therapies, but they only have a half-life of 5 to 7 minutes. So once they're administered, they don't last too long in the body before they get to their target cells. So that promotes another problem of administering it at the exact part of the body that it needs to help benefit, adding to the complexity of the therapy. However, they are able to change the bioavailability of these nutrients by adding coenzymes or coproteins to make them more stable. But again, that adds to the complexity of the nutrient interactions. Where will that will it make it to its pathway, the necessary pathway? So all of these challenges are what's keeping pharmaconutrition from advancing. But lastly, I'm going to just summarize what pharmaconutrition is. It's the actual evolution of immunonutrition, where it no longer treats an illness, but it takes a broad spectrum of symptoms and remedies those symptoms to improve the overall health of the patient. The case studies have shown, there have been case studies that show great benefits to this type of therapy, but again, the sample size is too small. So more studying, more reviews, anything to gain support from the large medical field is going to be very important for pharmaconutrition. Lastly, the interactions of the nutrients have to be well documented. We know a lot about the individual nutrition mechanisms, but when you add them together in these cocktails, a detailed understanding of what all the nutrients are doing is going to be very beneficial. So thank you for listening to us, and you'll see our questions posted below. Thank you. Bye-bye.